Well, good afternoon. I'm Rick Dancer. Welcome to the Buck Stops here, sponsored by Buck's Sanitary Service. We have a topic today that I'm excited to bring to you because I was listening to a local radio station the other day on KPNW, and I heard the gentleman you're about to hear, Dr. Roger Klien, talking about COVID and saying some things that I had not heard before and was not aware of. And I thought, I'm going to see if I can talk to this gentleman. He's in Ohio, and see if we can get him on so you guys can either ask some questions, I can ask some questions, and we'll find out a little bit more about what this is all about. And so let me bring him on here. There he is, Dr. Roger Klien. Roger, welcome to Oregon.
Oregon. Thank you so much for having me. Appreciate it.
No, I did. I heard you with Bill London the other day on KPNW, and I was listening on the radio and going, how come I'm not hearing any of this? And so we just thought we'd have you on and kind of answer some of our questions here. Can you, first of all, tell people, why you're into this, what your credentials?
Yeah, so I'm a pathologist by training. I'm with subspecialty board certification molecular genetic pathology. And I also have subspecialty training in microbiology and virology, which is directly pertinent to this topic. So, and I've for the last 15 years or so, have directed the types of laboratories that would test for COVID-19. I also have a background in emergency medicine. Most of my training was at Yale, and I also trained at Mayo Clinic.
You said you've done some work with the CDC as well, right?
Yeah. So I've been an advisor to CDC, to various departments within HHS and various departments within CDC, FDA, and CMS, which is the Centers for Medicare and Medicaid Services.
So when you look at this whole thing, what's your grasp? Give me like an opening comment from you. I've got a bunch of questions here, but I kind of want to get started with you.
Well, in my view, we have an infection that is a respiratory infection that is behaving. The best analogy I could make, and I know people don't necessarily like it, but would be like a severe flu that we haven't seen before. So it's transmitted through a respiratory vehicle like influenza, and it's possibly more, at least for some groups, I think probably more lethal and more serious. But we haven't seen it before, so it's rapidly spreading. And I think, unfortunately, I think the media, largely it's media driven, but I think the public has been given a misinterpretation or a misrepresentation of what the disease is for most people, because we've looked at mostly what we've seen on the media and through interviews with experts and even some of our government officials. The discussions have primarily focused on this very thin sliver of the sickest patients, and that's who we've seen for the most part on television. And as a result, I think it's misrepresented what in fact this disease is. We've also been encouraged to believe that we have more control over it than we do, and I think that's probably one of the worst things about this, because we've had unrealistic expectations.
What do you mean? What do you mean more control? We think we have more control than we do. What that? Because is locking people up and asking them to stay home and quarantining them, is that logical?
Well, in my view, it isn't. So if you take influenza, and again, let's say, okay, influenza is estimated to kill about 60,000 people a year. Let's say this is more deadly, and especially for older people, elderly people. What I would say is that it's about, let's say it's twice as contagious, and it has this window when you can spread it where you're pre-symptomatic, and you also have a lot of asymptomatic individuals who for several days can spread this. So it's more transmissible probably than influenza, at least many people believe that. And you have a longer window of time for people to spread it who don't have symptoms. we couldn't control influenza. We couldn't control the flu by locking people inside their houses, nor would we ever dream of doing it. And I think it's unrealistic to believe that we can control this in that manner. We've been encouraged to believe that our conduct, I think, has more to do with the spread. And don't get me wrong, you can protect yourselves, and we can do a lot as a society to protect those who are at most risk for death or serious complications in a targeted way. But our ability to control this is limited. We are human beings on a planet coexisting with a virus that, unfortunately, as small as it is, has a lot of power.
Is this a virus that has to run its course? And is it going to do what it's going to do no matter what we do?
I believe that. I think it's looking more and more like that. If you, for example, if you look at the Spanish flu in 1918, 1919, it took a year and a half, 2 years. It had to run its course. Basically, enough people more or less have to get infected, or if we get a vaccine, that will create the same type of immunity. But enough people have to develop a level of immunity. I'm not saying it has to be perfect, but they have to develop a level of immunity, so more or less the virus is blocked when it doesn't jump from one person to the next. It slows down its spread, and kind of the epidemic winds down. But I just don't think it's going to happen without it's not going to disappear, is what I would say. And I think we've been misled to some extent, or have been given false hopes that our conduct could eliminate it. And there was a paper that, and I want to say this, and then I'll stop. But there was a paper that came out in the Proceedings of the National Academy of Sciences just in the last few weeks. And while I'm not in love or enamored with models, these folks estimated that we would need to take all symptomatic infections and one third of asymptomatic infections, over 1/3, and we would need to isolate them. So we would need to identify millions of people and isolate them in order to suppress it, not eliminate it, suppress it to 1% of the population. Well, what's going to happen once you suppress it? Do we have the ability to track and control, millions and millions of people, and to test millions of people on a regular basis? Of course not. And so this is a situation where it got almost no attention. And in Proceedings of National Academy of Sciences, very, very reputable journal, no attention from authors who look, they were advocating more stringent measures. But the truth, if you're honest about it, given what we know about the number of infections in the United States, there is simply no way we could quickly enough identify over 1/3 of the asymptomatic cases and isolate them. It's not going to happen. And so we just need to understand. And again, it wouldn't eliminate it. It would just suppress it. So I think we have to be realistic.
So one of the things I haven't been able to find in Oregon, and I've called people and doing some research, is how many of the people that we're having more testing and we're having more numbers and cases are rising, how many of those people are asymptomatic, are actually getting sick? Are there numbers in other places that would show us that?
Well, most people don't get seriously ill. That's for sure. I mean,
so when you say most people, is there a percentage about?
Oh, well, I mean, the death rate is probably 1 to 4 out of 1,000, and that's including all these old people. 50% of the deaths have been sick elderly people in nursing homes. And look, every death is sad. Don't get me wrong, but we lose 60,000 people a year to the flu. 500,000 people a year die from smoking-related illnesses, and we're not panicked about that. We still have cigarettes on the market, and in fact, we take away vaping, which helps people potentially stop. So I think. I think that I can't give you an exact percentage, but what I would say is the vast majority of people early on in the epidemic, nobody paid attention to this, but in Los Angeles County, they looked at people who came in with basically what they called mild flu-like illnesses. So flu can be pretty serious. These were mild flu-like illnesses. 5% of those folks tested positive for COVID-19 at that time. And this was in March. These were people who were seen in mid-March. But it got no attention because it didn't fit a narrative that people wanted to tell, that of this being such a serious illness. And don't get me wrong, for some people it is. It's just of the vast majority of people do not get seriously ill with this disease and certainly don't die from it.
Would more testing help? Does more testing help?
It does, to a point. Early on, I think it was useful in trying to understand the disease better. We do know, we have a very good idea of what this disease is. We're testing more and more people, and that's part of the reason that we're having more cases. And this is not to say it isn't spreading. Of course it's spreading, but early on in the epidemic, all of our testing was directed toward the sickest people, mostly people in hospitals. We didn't test a lot of people outside the hospital. It was deliberate and by design. When we did that, the cases that we saw were really, really bad because they were everybody in the hospital. Now we're testing a lot of young people, for example, who go to a party and somebody's positive, and we test everybody who went to the party and none of them have symptoms. And look, anybody at any age can die from this. Again, I don't want to minimize it and say it's nothing. It's not nothing. It's just misrepresented as to its usual course for most people.
So in Oregon, our governor has now made it mandatory to wear masks outside if you're within 6 feet. If you can't stay away from 6 feet away from somebody, and inside. And groups of 10 or fewer can meet, but not more than 10. And yet we're still allowing protests to go on in communities. And we're going to take the cause out. The protests, the reasons for the protests in terms of equity and that sort of thing, everybody likes to mess them all together. But I'm saying if we have a pandemic and we have these rules, what is that? Our protesters in Oregon, they're saying that people in protests are not getting this.
Yeah, well, this is an unusually clever virus, and it sort of knows who it's infecting. I'm teasing.
No, I know.
Okay. But yeah. So let's be. The way it spreads is by prolonged close contact. That's so. It doesn't matter what activity you're doing. A mask, maybe it'll help, maybe it won't. We don't really know the extent to which masks help. Even what people can tell you, what they can tell you, we don't have direct evidence of it. We have droplet evidence that in some circumstances it blocks droplets, and some types of masks obviously work better than others. I mean, a scarf isn't the same thing as an N95 mask. But I think, if you're in prolonged close contact with people, it's going to spread. And once it gets into that population, if people do remain, they will transmit it. But if you have a lot of young people, and most of the protesters are young people, many young people have no symptoms. And so there could be infected people. There could be lots of infected people among the protesters. Unless you take a group of them and test them, you really don't know whether or not they're getting infected.
I heard you saying on the radio station that now in Cleveland, where you are, right?
Yes.
That the reports did show that this was happening in all groups of people.
What we found, what was announced by the city were the numbers, and we saw this enormous rise of within the infection period after the protests that we had. We had riots here as well. We can't. I don't think there was sufficient data to attribute it solely to the protests, but what it suggests based on the temporal relationship is that protests certainly played a role in spread. And I've seen news accounts in Houston. I saw that were a group of protesters who got infected at the protest. They know they did, and they were all infected. They were together. They were all wearing masks, by the way. They were interviewed for Houston News. It really depends on how hard you look. Cities like New York, they're saying they're not getting infected, but I think it's probably a combination of the fact that so many people already have had it there. I mean, they did, people did studies and found 25% of the people had already been had antibodies, and these young people, they don't know whether they're infected or not. They get a mild cold, and they don't really have the same kind of symptoms. I'm not saying nobody. I mean, look, there are young people and examples of young people who die, but it's very, very uncommon, and most of the time they don't get sick. So you're looking at a group of people, and that's why these cross-country comparisons are really sort of foolish, because if you're not testing people, you don't really know. So if we're not looking at people who don't show symptoms, we don't know whether or not they're infected.
So what about going back to school? Because that's a big conversation. Parents are concerned. They're wondering where we go, and whether we go back to school. What are you thinking from what you know and your knowledge?
Again, we have very little data on all of this that's systematic, where where we've isolated certain factors and we can see for sure that factor's impact on any of this. And so getting to schools, we have very little data. The data that we do have is limited. And what it suggests is children are probably not worse than adults at spreading it. We don't know whether they do or not. You see reports, and I listen to the same shows probably as a lot of your listeners, and you'll hear one person say, "Oh, it's going to be horrible. The kids are going to spread it all over the place," and then another person will say, "Oh, it's going to be you don't have to worry at all. Kids don't spread this disease." Well, it seems it defies common sense to believe that kids can't get infected and spread it. And I think they will, but that doesn't mean they shouldn't go back to school. They rarely get sick from it. So if you don't test everybody, so if you just look at a population and nobody gets sick, you can't say, well, nobody got it. You really need to test groups of people to see whether or not they've been infected. But in my view, they will be. Now, one possibility or one theory is potentially that they get a lot of colds. The younger kids always have a cold, and some of those are coronaviruses, which have you have a biological genetic relationship to the viruses, to this COVID-19 virus, the SARS-CoV-2 virus. And it is conceivable that there's some cross immunity in children because they've had colds that kind of look like, they built an immune response to it, but we don't know that. It's a theory. We don't know for sure whether or not that's true. What we know is that children, when they get infected, tend not to get sick. The flu is worse for children than this, and we don't fully know why. But are they immune from spreading it? I don't believe so. In fact, I heard an anecdote, and it's from a nurse. I don't know if it's true or not, of a camp where some children went to camp, and what happened was the kids they were not sick at all, nothing. But parents were getting sick, and so they ended up testing children, and the children were positive.
So, Roger, is it true that the corona COVID test shows a positive result for any corona, such as the common cold?
Well, that wouldn't be true. The PCR test, first of all, there are two types of tests that we're usually talking about. One is a diagnostic test, and one would be an antibody serology test. The antibody tests have a potential to cross-react, and that would be a mistake. That would be a false positive. Some of them do, some of them don't. And it really depends on the assay. It doesn't happen frequently, certainly for the better ones. The PCR tests or the antigen tests, which are diagnostic, it's mostly PCR tests right now. There's, I think, at least one antigen, I think maybe two, but they're not in as widespread use yet. Those are quite specific, and they're not going to they aren't going to in general. Those are not going to pick up a cold, one of the regular circulating coronaviruses, and mistake that for SARS-CoV-2.
So, in terms of what can we do to protect ourselves? Let me ask you this first: is this like one of the most political viruses you've ever seen?
It is, and But I want to make something clear, and because getting back to schools, I believe children will get infected, but I believe that it's important to go to school and do the best you can. It's political, but I also think we should emphasize, at least in my view, the decisions that we make and how to manage this as a society they're policy questions which fall within the political realm. They're not medical questions. When people get up and say the medicine should decide, the doctor should decide, it's not true, because doctors don't know economics. And so what we need to do is look at all of the considerations. We need to look at, doctors can inform, epidemiologists can inform on health related to the extent they, it's all expert opinion. We don't have a lot of data, but we can certainly weigh in from that perspective. But you have economics, you have social unrest. You have all sorts of considerations that policymakers have to engage in. So, for example, a decision to shut down businesses, that restaurants, where you have a lot of working class people, many of them don't have high incomes, they don't have a lot of savings. To throw lots of people out of work for a disease that, as we said, for most people is pretty mild, and where there are really good ways, mostly of staying apart from each other and putting barriers and all sorts of things where we can protect customers, does it make sense to lock these people down? Does it make sense to take young kids and lock them in the house and they get so stir crazy that they go out and break windows, for fun? I mean, this doesn't, we have to use common sense again in terms of approaching something that is analogous in some ways to a natural disaster. We have limited control over its ultimate course, but we can try to influence the outcomes and how we deal with it. In my view, and I've said this all along, it's for months already, that we need to learn to live with it. It's going to be with us, and there are ways to protect people, especially those who are at risk. And some of it's on an individual basis. Those folks who are mobile and around and getting out need to do it themselves, and those at risk especially. But anybody who doesn't want to get sick, and then you have people who are living in nursing homes or other institutionalized settings where they don't really have control over their environment. We can protect them. We do it in hospitals. We're not having outbreaks in hospitals. We can do it in nursing homes, but it's expensive, and we have to understand, if we're going to devote resources someplace, let's do it in a way that's going to minimize deaths.
Because that's where I heard 50% of the deaths are in nursing homes or facilities like that. And you were saying if we beefed up the way and treated that like a hospital, that could help save the lives of so many people.
Yeah, the initial outbreak where we first found out about this was in Seattle, and the Klien nursing home had an epidemic that went rampant there. We didn't have testing because it was really a governmental decision not to let, for example, University of Washington test. FDA decided they shouldn't be allowed to test, even though they provide testing every day. But what happened was the Klien nursing home, there was an outbreak and a lot of people died. And those types of settings, first of all, you need to be continuously monitoring. So we need to have regular testing of both staff and the residents. And when we see something, you have to jump on it, and then we have to take a lot of sanitary precautions and have use for aids of protective equipment, and they have to have really good hygiene when they go from one person to the next. They have to make sure they wash themselves like we do in a hospital. We have hand sanitizer, and we're constantly trying to make sure we don't take infections from one person to the next. If we do that, I think we can save a lot of lives, and that would be one definite. That would be one way for sure, at least in my view, it would be one way for certain to minimize the death from the disease. And that's, again, I think what we have to do is target reducing deaths, making sure as few people die from it, trying to protect those who would get seriously ill. And again, some of this has to be self-protection. A lot of it is staying away from other people, spacing out when you're near other people, but then also avoiding contact with a lot of people for those at risk. I've been an 87-year-old father. I'm very diligent in trying to encourage him not to go into any sort of crowd and not to go near other people. I think we can do those things, and it's going to run its course, and it will, as a society, come out better. And I think it's important. The president, I've got to say, I think we're lucky that he's out there, and he takes so much flack for saying that to get things moving, to get things back to work. He's trying to help us normalize the situation and to go on with something over which we have limited control, at least in my opinion. And to go and to shut society down indefinitely is really something you've never done before, and something that it's very, very hard to justify.
Okay, someone on here says, Nancy says his education is valid, but he's aligned with Sean Hannity, which kind of says it all. He is a physician Fox consistently uses to poo-poo COVID-19. I don't watch Fox or any television, so I don't know. The majority of science, this is the point I wanted to point to you, the majority of science is in direct conflict with his stance. What do you say to that?
Well, so first of all, I would like it if Sean Hannity would invite me on. So if you have any in there, please.
So you've never been on there?
I am not on Sean Hannity's show. I do go on Fox sometimes, but I haven't been on Sean Hannity's show.
Okay.
But what I would say is that the problem is people are misquoting science, because science depends on evidence. So it depends on experiments and evidence. And what we're doing right now is what we're doing right now is
your dog's
I know. We're giving expert opinion. We're giving expert opinion. And so what you're hearing you may hear people that they call experts, but they're not the decisions that the information they're providing is not based on scientific data or experimentation. For example, masks. And what I will tell you is we have data in controlled settings that masks, at least some masks, block droplets. We have a theory, a belief that the greatest mode of transmission is through droplets. And so there's an extrapolation that masks will prevent spread. But we have no data, no direct evidence that masks do prevent by the general public prevent the spread of this virus. And so it's an opinion. And I will tell you, and this is what I will use as evidence for this, that CDC consistently said not to use masks. If you look at their influenza recommendations, they say don't use masks. We don't have data for that. Yet influenza is less contagious and has a shorter window of time of contagiousness. So if masks don't work for COVID, if masks don't work for influenza, they're not going to work for COVID, which is more transmissible.
So is this happening because does it kind of show that we just really don't quite know what to do?
I think people don't. I think in part we don't. I think, yeah. I think we're operating in a vacuum of limited data. Again, I think that there's limits to what we can do. I challenge people to find scientific papers, not calculations by epidemiologists who make assumptions and put together and crunch numbers based on the inputs that they put in, but real data, real empirical data that is able to adequately correct for the multiple factors involved. I challenge to show me papers that are supportive of anything other than spacing people apart and hygiene. Because we have some data. There are meta-analyses on this, and I think the best evidence is for those two things, for spacing people apart and hygiene.
So Jennifer asked, there is a problem. There are ways to protect the public, but people are fighting it. China and Italy shut this down quickly. Everyone was pretty much on the same page. We here in America, USA, in my opinion, come from an instant gratification mentality. We want what we want, and we want it regardless of the negative implications. Yeah.
So first of all, I for one have been skeptical of anything that comes out of China. I don't even believe what they say. So that we're not getting reliable data from China. Their tests don't work. We don't know whether they're testing people. We don't know how much it's spread. We don't even know what's happening there. And the other thing is they could have a very different immune background. China is not the United States, where we have wonderful systems of sanitation. They have these markets with animals and all sorts of other things. They don't have this is not the United States, a rich country like ours, where we have so much in the way of public sanitation measures. And it is quite possible that they have been exposed to certain viruses that resemble the COVID virus, and it's created a level of immunity to that virus that we don't have. So we just don't know. And So I don't, and Italy is not a good example at all, because so many people got infected. I mean, what probably happened, what may have happened in Italy is so many people got infected. I mean, they certainly had a much worse experience than we did in almost everywhere in the United States, including New York. I don't even think New York didn't approach Italy.
So what is the best thing people can do? Is it really washing your hands? And if you are at risk, staying away from other people? What is your advice? I'm asking you. Let me ask you this first. So I hear all the time from people, where do I go to find factual information? Because everybody throws, when I put an article like this, everybody has to throw their PBS or their, Fox News or somebody's link to some information. And where do people go? And then they go, well, you go to the CDC. But where do people go to get the information they need to make just practical decisions?
Well, I think it's very hard. It's very hard to sort it out. It's extremely heavily politicized, as you suggest. Again, because in some respects, a lot of these are policy questions, and we're in an election year. It's very hard. But I think the bigger problem is we have a situation of emotional contagion, of essentially mass panic. It's just a really crowd mentality, and people feel that they're frightened. And the media.
I think people are really, we're opened up a little bit here in our section of Oregon, and I still don't see people out because I think they're just really super frightened. And I'm not making fun of that. I'm just saying I think that we have scared the shit out of people.
Yeah, that's exactly what's happened. And so the truth is, the masks are almost like a pacifier. I mean, you have people want to feel that they can do something. Right. And so even though we don't have data, that direct evidence, and I'm willing to look at something just came out from Mass General, and they chronicled some healthcare workers, not public, a healthcare setting, but we were talking about the healthcare workers themselves getting sick, not the public not spreading it in public, which is supposedly the rationale for these masks. I think what we have is politicians, want to feel like they're doing something, and then they want to one up the next politician who they don't want to be accused of doing nothing, and then one wants to say, well, we're doing this, and the others we're doing that. But I don't believe that any over the long run this stuff is going to ultimately affect the course of this epidemic. I think so. What can people do? This would be everybody doesn't have to get it. So I don't believe every person has to get it. I think we can protect people who are at the highest risk. I think, again, we should be societally, as a society, we should be very vigorous in protecting people in nursing homes. Very vigorous. Yeah. And I think elderly people who are sick, people with almost everybody who dies has multiple medical complications. I think we need to those folks who are mobile and walking around, they need to protect themselves. They need to stay away from other people. They need to stay away from crowds. If you don't want to get sick, don't go near other people. I mean, I'll tell you something. I'm not old, but I'm not young. I'm certainly at risk for this, just like anybody else. I don't go. This is just me personally, and I with knowing with what I have, and I've spent a lot of time on this epidemic. I stay away from people. I mean, there really isn't, and I hand sanitize constantly when I touch things. And as frustrating as it is, it's very, very difficult to be so diligent and compulsive every time you touch something and you're sitting there with hand sanitizer.
Well, I'm kind of the same way. I have alcohol, I'm wiping my hands down in the car.
And don't touch your face. I mean, if you're, it sounds silly, but that's how you transmit these things. And that's one of the reasons, for example, masks. It's possible, they might encourage you to go like this with your face, and you're adjusting it, and you're touching this and that, and then you touch the mask. And the other thing they do is as I suggested, was potentially encourage people to get closer to one another. So I'm not arguing. I don't know that they don't do any good. I don't know that they do, and but I suspect over the long run, they're not going to have any sort of impact, because I think, again, it's got to run its course.
So one of the last thing, I don't let you go, but one of the things we hear all the time here is you're not protecting yourself with a mask, you're protecting other people. Is there validity to that?
Yeah, we really don't have direct evidence for it. Well, we keep the masks, at least some masks, block droplets. We believe that it's spread by droplets. Can the virus get around the mask? Of course. So if you're next to somebody and you're wearing a mask, can you transmit the virus to somebody else? Sure. And that, again, I said that the people who were outside protesting in Houston claim to have been wearing masks. A group of them got it. So I think, could it help under some circumstances? Potentially. I don't think we fully understand when or where. Is it a horrible idea if you're close together to wear masks? No, and I'm not opposed to it. I just think that people have a misconception that this is some sort of answer. And the truth is, to me, for example, when they say to you, if you can't distance, wear a mask, I don't put myself in situations that I can't distance. And that would be my message. If you don't want to get sick, stay away from people. Don't get close to them. You're in the grocery store. Don't go right up next to people. Now, walking by somebody for 2 seconds is not likely to transmit the disease. But if you're, 5, 10, 15, 20 minutes right close next to another person, you stand a risk of getting that disease, and a mask isn't going to protect you. So I think we need to be realistic about it.
Can I ask you a really weird question? And this could get me in some hot water, but which at this point is more dangerous, the fear or COVID?
Well, I think the fear presents greater systemic and societal risks because we overreact, and I think by overreacting, we've created tremendous turmoil. I know you've had protests in Portland before. It's not the first time, but we have not seen anything like what we've seen. This type of civil unrest, the destruction, the riots. In Cleveland, I mean, we had stores and smashing windows and all sorts of things. And it's hard to believe that this doesn't have at least some relationship to some of the measures that we've taken to ostensibly protect against COVID. The people, again, I think we were talking before, people who are making some of these decisions, they're very secure in their lives. They, whether they're a government, bureaucrat who's, doctor bureaucrat on television or a faculty member, other folks who they don't have. They're not in touch with the way a person who works in a restaurant lives. They don't understand what it's like not to have any savings whatsoever and to have your income cut off and not to be able to feed your family. There are people in the travel industry, the entertainment industry, the restaurant people. These folks don't have a lot of money. And even look at small business people. Some of them who are somewhat affluent, they spent their lives building businesses that can be completely destroyed by shutting them down for 3 months or 4 months or longer. And the question is, what's the justification for this? Why it is, from a public policy perspective, does it make sense to react in a way that creates so much harm? And you even get other medical problems, suicides and alcoholism and drug addiction, child abuse. These kinds of things are all up because of the enormous stress on society. Some of that stress is going to be there no matter what. People are frightened, but we've made it worse by in my opinion, by overreacting in a sledgehammer-like way rather than in a targeted fashion, understanding that this thing is just too contagious with too many asymptomatic and mild infections and too long a period of pre-symptomatic period where people can spread it. That we're going to be able to control this. I don't think that was probably ever on the table in a country of 330 million people with multiple points of entry and egress. Though, if you could lock down if we could have locked down the borders and everywhere in the country and gotten everybody who had it initially, maybe. But we have people coming in and out of the country all the time. We have people traveling from state to state all the time. And it's just not a realistic thing to believe that we can have control. We can influence it. What we should do is try to prevent deaths.
So Matt McCarles brings up a good point. I've been calling it a disease off and on. It's actually a virus. It's not a disease. Somebody writes on here, they have no idea how hard it is owning a restaurant right now. They also have no idea how hard it is to be mask police. And the general public doesn't understand how serious Oregon OSHA actually is about it. So, yeah. Doctor, thank you so much. I've had questions. I've called people around here, different places, health department, haven't had any answers. And when I heard you on the radio, I thought, this guy's got some different ideas, and I think we should be presented with that. So I appreciate you taking the time, especially Ohio. You're getting close to 8 o'clock at night. You should be taking care of that dog, not some guy in Eugene. Yeah, a lot of people are coming on here saying thank you for the information. So, folks, while he's on here, we are not saying protests are wrong. What they're protesting is wrong. The comments that we're bringing up are, should we assume that the virus is also spreading in that group of people since they're in close proximity? Yes. We're not saying what they're protesting is wrong, so don't write me any letters and don't get me. We are also not anti-mask, okay? He's just telling you what the science is and what the information shows from his perspective. So if you have a different one, that's fine, and I welcome you to talk about that, but don't use harsh language and don't put people down. Doctor, thanks again. That was my little Father Rick attitude.
It was great. Thank you very much for having me. I appreciate the conversation. It's important to have these kinds of discussions.
No, I agree. And I thank you so much for your time. See you later. Thanks, Doctor. All right. I'm going to go like that. So there we go. Again, some of the rest of you are bringing on other comments on here. What about minimizing underlying risk factors? I'm sorry, Kathleen. You know what? You can put those questions on there, and the doctor might be able to get to those. Here we go. That's not much that is talked about with diet and nutrition. Kathleen, I would 100% agree with you. In terms of what? Hold on, doctor.
I agree.
Can you see this?
Yeah, I agree with this. I agree with this statement. People aren't talking about it, but it's part of general overall health. People who are healthy are going to deal better with an infection. So absolutely. And in fact, one of the reasons that and I'm not telling people, by the way, to go out and do this, but one of the reasons that influenza has been hypothesized to be seasonal and more contagious in the winter and affect more people in the winter is because under the theory that perhaps vitamin D levels drop because people go out in the sun less and get less vitamin D. I'm not saying that's true. I'm saying that's a hypothesis that is not proved. But I think, and so I'm not encouraging people to go out and start taking all kinds of things, but including vitamin D tablets. But what I would say is, the healthier you can be, the better you're going to handle an infection. And part of health is diet and nutrition. It's a great point. People don't talk about it enough.
Something that a doctor, it's just been crossing my brain all the time is how many people, and this is not to discount COVID. I just get so tired of people putting words in my mouth. But if looking factually at science, how many diseases in this country are killing people because of obesity and heart disease, poor diet, lack of exercise, and we don't bring this to the forefront. We cover up the real problem rather than taking care of what could happen.
I agree, and obesity is a serious risk factor actually for in COVID.
It comes up in a lot of them. I mean, a lot of people I see that in the statistics and stuff.
Yeah, and so all these problems that you're talking about, a lot of our illnesses here are unfortunately lifestyle related. We're a wealthy country, and we have, we overeat and we indulge in behaviors. We don't get enough exercise sometimes, and I think our lifestyle is extremely important. And this is really a great point that people who want to protect themselves from this disease, and not catching it is to stay away from people, and that's and use hygiene. But doing well with it when you get it is being healthy. And so people who are saying build and strengthen the immune system, that's all part of being healthy. This is all part of being healthy, which means diet and nutrition and exercise.
So, and also while I have the doctor here, we're not saying to go against the governor and her mandate about masks or anything like that. We're just saying educate yourself. And you know, for me, I put the mask on because I want my business friends to be able to go to business tomorrow. And I think that helps them. I can rationalize it that way. But, you know, I'm not trying to be a rebel. I want facts to base. It's hard to go against when something doesn't rise in your gut, right? And you are forced to do it. There's this battle you have to do with yourself. You know what I mean?
There is, and I want to say something about this because I think it's very important. You know, first of all, if there's a law that you have to do it, you know, if you want to be civil disobedient, that's fine in public. But if you go into a restaurant, for example, that restaurant owner is responsible for your conduct, and that's a private business, and that restaurant owner is trying to comply with the law. And I really do think that it's important to respect the business. It's really not about you. This owner may or may not believe in it, may or may not want to force you to do something, but she or he has to do that. And I think it's really important. I'm trying to put the data out there. I'm trying to have a serious discussion so that to treat people like adults so that they can make decisions with information as it really stands, rather than trying to frighten them or exhort them to do something based on any sort of motivation. But rather, the idea is to think, and I think respect for one another. Well, respect for one another is extraordinarily important, and that includes business owners.
Well, you know, doctor, I would just recommend to you, because I have run for public office, and if you really want people to think, and you really are about those things, you probably should never run. I don't think I'm not an expert, but I don't think you're going to do very well.
Well, unfortunately, I don't know. I'm a little more optimistic. I think people, you know, they're unfortunately we've conditioned people to respond to sound bites and not to analyze issues. But I think it's very important that we have discussions, because these are huge and impactful changes that people are making in their lives right now in order to live with a virus that's is likely to be with us for a while, and we need to have intelligent conversations about it, because there's civil liberties and other sorts of issues that individual rights and freedom that also are at stake, and important values in our society that we also don't want to go away. So you need to have discussion, and it needs to be respectful. And people, rather than hurling insults at one another, I think it's better if we can talk openly, and even if we have different interpretations of certain data or facts or beliefs, we need to be able to express those and do so civilly and with respect for each other.
And listen, it's so if we listen to each other and like our heart, rather than bashing people with the factoids, I think we get so much farther. So I think you're helping with that, doctor. And when I heard you on the radio, I thought, God, I wonder if I could get him to come on my show. And so I'm really happy that you did. And we just may have you back as this thing continues and see what's going on, if you're open to that.
Yeah, thank you. It's been a privilege. I very much enjoy the interaction with the audience as well. I think the comments and the questions have all been great. And appreciate the opportunity to respond to them.
Okay. All right, my man. Thank you so much, doctor. You guys give him some props. I'll talk to you later. We'll see you, doctor. Thank you.
Bye-bye.